Contracted eye socket reconstruction with free microvascular flaps and other flaps. In this presentation, reconstruction of contracted sockets is shown with methods using microvascular flaps and flaps from nearby area. The vascularized flaps available are forehead temporal pedicle flap or island flap, midline forehead flap. This flap, famous for having been described by the ancient Indian surgeon Sushruta, can be transposed to line the socket. The donor defect may be closed primarily or be covered with a skin graft. It can be made oblique if more skin is needed. Superficial temporalis fascia covered with skin graft and raised on its blood supply. This can be transposed into the socket. Microvascular free flaps. Severe contracture of socket post irradiation. Forehead flap for lining the socket was used. Donor area covered with skin graft. A ceramic orbital implant was inserted. Prosthetic eye shell given after 6 weeks. Post retinoblastoma enucleation followed with radiation, and here is the result. Median forehead flap for socket lining, especially in a contracted socket. Reconstruction completed with CMP. Microvascular free flaps. The use of microvascular flaps has the major advantage of single stage procedure. There are many free flaps available. The vascular anastomosis should be distanced from the irradiated area so as to ensure a safe blood supply. The flap should be preferably raised from a hairless area. The edges of the flap can be de-epithelialized and buried under the periorbital skin to correct the contour deficiency. Further procedures to improve minor deficiencies would be needed besides the fitting of an eye prosthesis. The various flaps which have been used are radial artery, lateral thigh, medial and lateral arm flap. A severely contracted socket post retinoblastoma treatment. A lateral arm flap as a free flap was raised. The contracted socket was lined with the lateral arm free flap. Flap was de-epithelialized to fill the contour deficiency in the periorbital area, as there was excess of bulk laterally. Thinning of the flap was done subsequently, and a camouflage with spectacle was used. Another child with a post retinoblastoma contracted socket, microvascular free flap was used to line the socket. Multiple procedures were done to improve the socket and to retain the shell. Here you can see the child after the spectacles have been used. A post-irradiation asymmetry of face and contracted socket. Free flap for contracted socket was used. And here you can see the patient with a CMP. Post-retinoblastoma, severe contracture of the orbit with periorbital hypoplasia. Lateral thigh free flap was used to line the socket and periorbital area. And the final result, which is shown here. Post-retinoblastoma, severely contracted socket, free flap to line the socket, IFFS and SFFS to form pockets to retain the eye shell. Flap lining the socket. Some ulceration was noticed, which healed by itself. There was severe laxity of the lower eyelid, so the inferior fornix forming sutures were given along with a lateral canthoplasty. Subsequently, an eye shell was placed, which was retained well. Post metal splash injury producing a severe contracture of the socket. Multiple attempts had been made elsewhere. We did a median forehead flap for lining the socket, and an eye shell was fitted afterwards. Another metal splash injury due to molten metal fused upper lid and lower eyelid, which were adherent to cornea and the globe. Upper eyelid reconstruction with fricase flap, MMG for superior fornix and lining for flap. Conformer was placed and a tarsorrhaphy was done. Subsequently, a nasolabial flap for lower eyelid was reconstructed and transferred. This was lined with a palatal graft and it was used for the upper lid also. Both fricase flap and the nasolabial flap were sutured together. Incision was given to separate the lids and a CMP shell was placed, and here you see the final result. A road traffic accident producing loss of upper eyelid and a globe. Median forehead flap, which was lined with mucosa, was placed. Donor area over the forehead was covered with split skin graft. Division of the pedicle done after a few days. Scar revision over the cheek was also done. Finally, eye shell was placed and one can see the improvement. In this presentation, various types of flaps have been shown to reconstruct the socket. It is important to cover the socket with a custom-made processes to give good cosmesis to the face. Thank you. Any doubts, please contact.